We do have a couple of questions from the audience. There's a question asking, and I think this would fit in nicely with a lot of the work that Sarah Lee has been doing in the schools, and it's asking if there's any evidence that increasing physical activity in school that kids will enhance their academic achievement. It says we live in an age when which kids need to perform well on standardized tests, and schools are evaluated on how their students perform. Some educators probably see PE as a time that could be used studying. If we can demonstrate that physical activity actually helps students with their health plus academic achievement, then there's likely to be better acceptance. Sarah, could you perhaps comment on this?
Sure, thanks for the question. In 2010, we at CDC, along with other collaborators in the research community, released a report focused on exactly your question. It looked at a synthesis very similar in nature to this Midcourse report, where we looked across studies and multiple aspects of the school day, recess, physical education, after school activity, and classroom-based activity breaks, and looked at where the evidence is related to the relationship between school day physical activity and academic performance. And we looked at both cross-sectional research as well as intervention research, and came out with a conclusion that if there is a relationship, there's clearly growing evidence in the area, and that adding more physical activity to the school day does not negatively impact, and in many cases positively can impact and have a relationship to academic performance. So there is a report that synthesizes that information, and it's on cdc.gov/healthy youth.
Thank you, Sarah. Another question that might fit in well with Janet Fulton's work on the community setting, or Robin McKinnon, says the draft report is great and will be a widely disseminated resource. After school and before school programs get little emphasis in the report, but have a lot of potential for keeping kids active. What will the final report say more about the research needs in out-of-school time programs? Janet or Robin, could you speak to that a little bit more?
Janet, it might make more sense for you to start off.
Sure, Robin. I'd be happy to do that. Hi, this is Janet Fulton from CDC. Yeah, we reviewed the evidence looking at after-school or outside of school programs, and really that evidence is just not quite there yet. I think we called it suggestive or emerging right now. And that really has to do with just the fact that there weren't that many reviews to examine in the document. So I would say it's a promising strategy to use. I think people are doing those types of interventions now. They're in the field, but there wasn't actually enough evidence to recommend that strategy in the report.
Right, and this is Robin McKinnon. I would just add that this may be one instance where this is a limitation of the methods, just as Janet was saying, that this is a review of the reviews, and they may well be individual studies and individual programs that are going on. But if there wasn't a review that looked specifically at after school or those types of things and amalgamated that information, then we weren't able to make a firm recommendation there. So we definitely want to see more research in that area.
Thank you, Janet and Robin. Another one actually that fits in well with Robin's work on the community setting and built environment. It's asking, now that we have identified these specific settings and opportunities to increase physical activity among youth, what can we do to coordinate these sectors to work collaboratively to implement evidence-based interventions, taking a society-wide approach? Robin, since your work on the built environment touched upon engaging multiple sectors, I thought you might be appropriate to answer this question.
Right, and there really seems to be a tremendous opportunity to change the environment in which we work, live, and play to impact the entire population, youth obviously, and adults as well, to be more active. and so we can have an environment that's supportive of activity rather than, which is often the case, it may negatively impact activity. Now, there are a number of ways that that sectors can be coordinated, and that can happen at a variety of levels as well, at the local level, at the state level, and also at the federal level. So I think there are a number of initiatives that are starting this work. For instance, the National Physical Activity Plan. There are local groups, local jurisdictions that are working closely together, like in the city of Portland, New York City, for instance, and then other coordinating bodies at state and federal levels to bring those groups together. So I'm now that there's this growing recognition of the importance of these different sectors, I think the interaction between these different groups at different levels of government will only strengthen over time.
Thank you, Robin. I'd like to direct the next question to Dr. Kathy Jantz, who is involved in the home and family setting. And this is one based on looking at the evidence for the home and family was classified as insufficient, but this setting seems to make sense that this would be an important factor. Can you comment on why perhaps there seemed to be a lack of evidence?
Yeah, happy to comment on that. And I certainly want to reiterate your thoughts that it's probably a critically important area. Obviously, parents have a great impact on their children, and there is evidence that when kids are asked about who influences your physical activity, almost always parents are, if not number one, are very close to the top of the list. I think the problem is mostly about methods. It's much easier to do a study in a school where you have all the kids clustered, or even in a community where they're all at the YMCA, than to organize an intervention study where you're looking at specific families in their own homes.
Great. Thank you, Kathy. Risa, you might be best to take this next question. Do you have any suggestions on the best use of the report or next steps on how this could be utilized?
Well, absolutely. I think that this report provides a real strong opportunity for policymakers at all levels, but especially at the federal and state level, to rally behind the importance of increasing physical education and multi-component interventions within the schools, and to enhance the policies that will enable local school districts to do this. We talked a lot during the meetings of the subcommittee about the fact that these policies are often set at the local level, but I think these findings are so strong that it really should provide a clarion call for public officials, for policymakers at federal and state levels to really enhance physical education and enhanced physical education and multi-component approaches within the schools. So I would hope that this report leads to that kind of leadership among policymakers.
Great, thank you, Risa. I just wanted to double check if there was any outstanding questions from any President's Council members or final comments and thoughts on the overall report. All right, I'd like to hand things back to Shelley Full, the Executive Director of the President's Council on Fitness, Sports, and Nutrition.
Thanks, Katrina. So my question for our council members is, do any council members object to moving forward with the report to Secretary Sebelius?
This is Jane. I'm in favor of moving it forward.
This is McDonough. I'll second that.
Great, thank you. Hearing no objections, I recommend to the subcommittee that they move forward with finalizing the report and presenting it to Secretary Sebelius.